everyone. Welcome to Health Live at Seniors Today. We are here today after a week's break, the Independence Day, Janmashtami, Gokulashtami break. And we are recording this on August 23rd, 2025. As I mentioned the last time around, we will be mentioning the dates so that you know when this is being recorded. So if you do access it 2 years back, 2 years hence, you know that this could be a little dated. So you should perhaps check for new developments in the medical science. Today, we are delighted to have with us a very senior vascular and endovascular surgeon, Dr. Dhanesh Ravindra Kamerkar. He is head of the Department of Vascular and Endovascular Surgery at the Ruby Hall Clinic in Pune. He is also a consultant vascular and endovascular surgeon at the Jahangir Hospital and Medical Research Center in Pune. He is associated with the NM Wadia Institute of Cardiology, with the Pune Hospital, and he is also with the Healthway Hospital in Goa. Dr. Kamerkar has done his MBBS from the Topiwala National Medical College, the Nair Medical College in Mumbai, and he's done his MS in general surgery. After that, he's been a certified vascular surgeon, with the endorsement, sponsored by the Royal College of Surgeons of England, and he's a fellow of the Vascular Society of India. He also teaches and is a member of various associations of concerning vascular science in India. Welcome to Health Live at Seniors Today, Dr. Dhanesh Kamerkar. How are you?
Yeah, I'm good. Thank you, Mr. Maheshwari, and thank you for introduction.
Today, we've requested Doctor to have a session on an issue which is very important, and this is called leg attack. Okay, leg attack, and he will be talking about dealing with peripheral artery disease. And so, over to you, Dr. Dhanesh.
Yeah, thank you, Mr. Maheshwari. Good evening, everybody. As you all aware, that everybody has heard the term heart attack, and the same coin we have taken it to the leg pain as a leg attack, and also to stroke, what we call as a brain attack. So it's easier to understand the necessity and importance of these symptoms as a heart attack too. Now, peripheral arterial disease, basically what it really means is that you start developing narrowing of the arteries in the legs, as you must have heard that there is a narrowing of the arteries in the heart, causing heart attacks and heart blockages, and they would need either angioplasty or heart bypass. Likewise, you also start developing narrowing of the arteries in the legs, and that is mainly because of aging, smoking, diabetes, hypertension, and these are all the risk factors, high cholesterol. These are the same risk factors as one would have it for a heart blockages. And when they start developing in the leg arteries, what we call as a peripheral arterial disease. Now, the leg pain is a very common symptom. Everybody at some stage in their life keep on getting these leg pains now and then. What is really important is to basically differentiate a simple leg pain like a muscle cramp or something like that, as compared to something which is sinister and serious. So when somebody starts getting a leg pain in a peripheral arterial disease, so I'm going to call this as a leg attack, as we call it as a heart attack. So what is a leg attack? So when there is a narrowing of the arteries in the leg, so obviously your blood supply to the muscles of the legs get reduced. Now these leg pain basically comes only when you walk a particular distance. And if you stop, for example, for a while, maybe a minute or so, the leg pain goes away. The moment you start walking again the same distance, you start getting pain. And generally, commonly the pain starts in the calf muscles, and then it can also start getting into the thigh and buttocks, depending on the severity of the blockages and anatomy or the level of the blockages. So by and large, if there are blockages in the thigh arteries, then you start developing this pain on walking in the calf muscles. And as I said, this is arterial claudication, what we describe in the medical term or medical language. which would mean that you start getting pain when you only walk. You will not get this pain if you stand for a long time, you are sitting, you're lying down. Uh, this pain comes only on walking a particular distance because your muscles, when they start getting stretched, there's no enough blood supply in the muscles because of the narrowing and blockages, and that's when the muscles start craving for blood and you start getting pain in those muscles, and that makes you stop. In early stages of this, a person can keep on walking, but the velocity or the speed drops down, and then he can continue walking a longer distance. But as the severity increases, patient's distance, walking distance starts going down, and he has to stop, or maybe he can walk maybe only 100 meters, 50 meters, half a kilometer, whatever, and then he has to stop. Again, if he stops for a couple of minutes and walks, he can walk the same distance. Again, he has to stop. So that's arterial claudication, or what we call as a leg attack because of arterial blockages. The second type of leg attack, what we see also is in the patients with varicose veins or somebody who has had a deep vein thrombosis. You must have heard this word, deep vein thrombosis, where you develop clots in the legs of the vein. And one of the common causes of developing clots is because of post following a major surgery where you stay in the bed for a long time, or patients who develop fracture and stay in the plasters. You also must have heard about this word economy class syndrome, where during the long flights, when they get down from the flight, because of the 12, 14, 16 hours flight, the mobility is very minimal, which can cause thrombosis in the leg veins, what we call as a deep vein thrombosis. It's fairly also not uncommon following a pregnancy or deliveries. It can be seen also as with varicose vein. But again, one has to identify the cause of deep vein thrombosis, which is very important. So when somebody has a vein pathology like varicose veins, so what is a varicose vein? It's a ballooning of the superficial or outer veins of the legs. And when they start ballooning, they give you a appearance of knotty veins. And what is the risk with varicose vein? They can develop again thrombosis or clots. They can have a bleeding. They can develop wounds which don't heal. They can develop discoloration of the legs, what we call as a pigmentation. Now, what is the characteristic in these leg attacks because of venous pathology is that you get pain in the legs only when you stand for a long time, especially while cooking or ironing, or teachers or policemen, even surgeons do get varicose vein because of long standing hours. In today's day and age, because of so many IT jobs, people tend to sit at one place for many hours. So long sitting hours also can cause varicose veins, or sometimes even deep vein thrombosis or clots. So we specially tell IT people that every 2 hours you should get up from your chair and get your legs freed, drink a lot of water, so in order to avoid any clots. So this is the leg claudication because of venous pathology. You get pain only on standing, and this pain will go away when you lie down or when you keep the leg elevated on a pillow or something. The pain immediately goes away. So this is how one characterizes the differences between the pain because of arterial blockages and pain because of varicose vein or deep vein thrombosis. The third type of pain, which also we see in this age group, is commonly what is called as a neuropathic pain. What is a neuropathic pain? It's a pain in the distribution of your nerves of the legs. And fairly commonly, it is seen in people who have a long-standing diabetes, where their peripheral nerves in the legs start getting weaker. And this pain basically is constant pain. It is not related to any position, whether it is you're standing or whether you're lying down or whether you're sitting. And this pain generally characteristically is only in the distribution of nerve rather than the whole leg. So that way one can differentiate between a pain or a leg attack due to arterial blockages, or leg attack due to vein blockages or varicose veins, and leg attack due to peripheral neuropathy. You also can get pain seldomly because of muscles, skeletal muscles, or bones or injuries, and especially in the elderly age group because of reduction in muscle mass, sarcopenia. One can get pain while walking or standing too, essentially, but that's mainly due to generalized aging process. So this is how we would differentiate leg pains in a clinical setting. And then, of course, there are other rarer causes of leg pains, but these are very common. Is arterial problem because of arterial blockages where you get pain while walking and pain going away when you stop. Venous problem of varicose vein when you pain gets on long standing or long sitting and would go away on elevation of your legs, and neuropathic pain in the distribution of nerves. So I thought I would describe this such a common symptom and discuss about nuances and the severity, because that's the reason, especially in elderly age group, one should not take the leg pains lightly, and they should be getting investigated as early as possible, because the cause of this leg pain could be sinister and which can be basically avoided to go into the severe form of these problems. For example, if there is a arterial blockage getting worse and worse, one can land up with gangrene. You must have heard this word. And many times, if we don't act in time, patient may lose the legs. Also in varicose vein, if you start developing clots in extensive varicose veins, these clots, there is a potential that they can migrate to the deep system and can go to the lungs, which can be fatal too. And number three, in neuropathy, like especially in diabetics, if you get wounds which don't heal, they can land up with infection in the foot. They can have land up with gangrene of the toes. They can land up with infection in the bones. And if it is not picked up in time and treated, they also can undergo need an under amputation. So this is the reason that we should pick up these leg pains much in time, early in time, and treat them so that we can save the major complications like amputations of the legs or life-threatening conditions. I think with that, I will wind up the discussion and we can have a discussion.
Right. Thank you very much, Doctor, for your detailed opening note that you have and your details. We have a few questions that have come in. One question that I have got on my phone is, Doctor, is peripheral artery disease, is this and leg attack, is this hereditary in nature?
Uh, if basically if the family develops a cardiac or a vascular disease in a earlier age group, like between 40s and 50s, then it would be definitely worth screening the families in the next generation. But by and large, it is not hereditary.
All right. Uh,
Varicose veins can be hereditary because they can run in the genes. So if somebody in the family has varicose veins, then the next generation generally should be screened or checked for the varicose veins.
Doctor, a very basic question that is coming from Shamala Ravi is, what is the difference between vascular and endovascular surgery?
So essentially, what it means is that vascular surgery is an open surgery where you must have heard about the word bypass surgeries of the heart. So likewise, we do bypass of the arteries in the legs or bypass in the other parts of the body. So to put it succinctly and simply, the cardiac surgeon or a cardiologist will deal only with the heart problems. The rest of the all other arteries and veins in the body are looked after by the vascular surgeon. Now, over a period of time, there has been development in the modalities of treatment because of technology. So, a lot of these open surgeries have been basically converted or are able to do it endovascularly. So, what is an endovascular? Is you make a puncture in the artery, like how you would undergo a heart angioplasty, and likewise, exactly the same process, but instead of going to the heart angioplasties, we open up the arteries in the legs with balloon or put in a stent, what we call as an endovascular surgery. So it is a less invasive or minimally invasive procedure to overcome the blockages in the arteries, which was earlier done by open surgeries.
Right. Doctor, we have a question from Meena Goyal. She says, I was a teacher for around 22 years and I regularly stood up for that tenure. Now I have pain in my foot and I cannot stand for a longer period. Uh, what should she do?
So first thing is if she has any vascular surgeon close by to her, I don't know where she comes from, but maybe she should see a vascular surgeon nearby, and I'm sure he would do the investigation like doing a simple ultrasound or Doppler test of her legs, arteries, and veins. Now in her case, probably since she is a teacher, it is likely that she may have a venous pathology where there is a weakening of valves inside the veins causing varicosities. So the Doppler will suggest that. And if she's got a varicose vein or weak veins, then the generally treatment started with the compression stockings to begin with.
Right. We have a question from Sunita Verma who asks, what is the cause of restless legs?
So varicose veins can be one of the causes of restless legs, or neuropathy also can be cause of restless legs. By and large, when you investigate for restless legs and essentially find that
Connectivity
there
with
is no,
doctor.
sorry,
Let's just wait for a minute.
okay.
Yeah, sorry, we've got the connectivity back. Yeah.
Okay. So restless legs syndrome is a syndrome where because of various pathologies can cause the legs to be restless and they especially remain or happens at night. Varicose vein can be one of the cause. Neuropathy can be one of the cause. Severe arterial problems or critical ischemia, critical circulation also can cause restless. But going beyond that, sometimes you may not find any obvious cause for these restless legs, and they can be treated with like vitamin B12 or vitamin D, or sometimes even with quinine sulfate tablets. But by and large, the common causes can be addressed directly, either because of circulation in the arteries is poor, or varicose veins, or neuropathy.
Doctor, there's another question that has come in. Doctor, as far as the heart is concerned, we get our annual checkups. We do it detects any problems that we have because of the ECG, etc. Is there any checkup that we should do on an annual basis for detecting any issues with the legs?
So the simplest thing is to see a surgeon or vascular surgeon for clinical examination. But like how you have a 2D echo of the heart or ECG, likewise what we have in Ruby Hall is what is called as a vascular health provider, which is like an ankle brachial index, just taking blood pressure in all four limbs to upper limbs to lower limbs, and that would tell us if there is any circulation problem in the legs. That is one. And if there is doubt, then you can do a color Doppler of the legs to find out if there are any problems with the arterial blockages, or if the problems with varicose veins, or problems with clots or thrombosis.
Right. No, but is there any preventive checkup that one must do on an annual or every other year basis?
So ABI can be checked every year. Ankle brachial index, which is like a vascular health provider, and it's an ABI machine. So just taking basically when you go to your general practitioner, you get your blood pressure checked every now and then, correct? Likewise, you get your leg pressures checked from the legs and compare it with your blood pressures in the arms. It's the simplest test, and which would tell us if you're developing any blockages in the legs or not.
And approximately, what is the cost of this kind of a check test?
So this is in Ruby Hall, for example, is about 1,200 rupees.
So I guess that's the case with most hospitals or clinics that are there.
Yeah, and it's
This is available.
you can do that every year. And in case there is any abnormality in that, maybe more frequently.
Is it available at most hospitals or clinics?
By and large, those hospitals who would have a vascular specialist as part of the department, they would have it. Ruby Hall has it in Pune. Jahangir also has it in Jahangir. I'm sure hospitals in Bombay also too would be having with the vascular surgeons.
Right.
And it's
Doctor,
a very simple test. Hardly takes 10-15 minutes. It's just getting your blood pressure checked on two upper limbs and two lower limbs, and it's an automated machine. So it gives you automated reports straight away.
Right, thank you. We have a question from Bomi who asks, Doctor, for varicose veins, does wearing of compression throughout the day help, or are these stockings not advised?
Is that Bomi Boat?
Sorry,
Is that Mr. Bomi Boat?
I don't think no. This person is a regular.
Right.
Uh, yeah.
So yes, the compression stockings is one of the key treatment part of the varicose veins. But these are all short-term kind of treatments. From the longer-term point of view, varicose vein, if there are any weaknesses of the main valves in the groin or behind the knee, they should be dealt with so that you can get rid of the stockings on a long-term point of view. And they can be earlier, they would be basically treated with open surgery to ligate those valves. But nowadays, with the technological advances, you can close these valves and close this vein by doing a thermal ablation, like a heat, either with laser or with radio frequency ablations. And
Um,
it's a local anesthesia procedure, walk in and walk out.
Doctor, if a question that has come in, if one suspects an issue with varicose veins or some peripheral art ailment, is it okay to get a massage done once in a while?
As long as it is very light, it's okay, but no otherwise a rigorous massage for either arterial problems or venous problems, because that can worsen the problem. More so in a venous pathology in varicose vein, your massage can cause thrombosis because of injury to the dilated veins. You also must have heard that a lot of people and centers are using leech therapy for varicose vein. Again, that's not a good idea.
Right. Um, this is a question from Sunita Verma. What is the cause of cramps in legs?
So, again, varicose veins, long-standing or extensive varicosities can cause cramps, but by and large, you also one needs to check their levels of vitamin B12, magnesium, calcium, and so vitamin D, because deficiency of these also can cramps. Again, if the water intake throughout the day is not good, can cause the cramps at night. And another fairly common cause is patients having chronic kidney problems, like people who creatinine is high, they also can get cramps at night. But by and large, if your hydration is good throughout the day, the water intake 2 to 2.5 to 3 liters in a day, in a normal patient, generally one will not get a cramp. But if your water intake drops down, especially summers, or your activity is reduced, with combined with a low hydration, it can form cramps.
Right. We have a question from Ashok Kumar Bhatia who says, Doctor, I would like to know if angiography is the only way to know the extent of a blockage, or is there any simpler alternative to it? In case if someone has undergone this process at a certain time, what is the period of time and whether that blockage has increased or decreased with medicines?
So first thing is obviously clinical examination. The vascular surgeon will examine you, take your history and tell you whether how bad or severe is the problem or how mild is the problem. And the simple test like doing ABI itself will tell us how significant or how severe is the problem. Number three, again, going beyond that, you can do a color Doppler of your legs to see how the blockage is there. Angiography is planned only when you are basically considering an intervention, like if your problems are really severe and that needs an attention on an urgent basis or early basis, that is the time you do an angiogram. Angiography is like a road map. So you will use a road map only when you want to go to that destination. Otherwise, you don't do an angiography left, right, and center. So angiography is only in a severe form where you are planning to do some surgery or bypass or like an angioplasty. Then you do an angiography just to find out the anatomical location of the blockages, what is the severity of the blockages, and what would be the right way to treat these blockages either with surgery or with angioplasty. Like if I want to go to Kolhapur from Pune and I don't know the roads, then only I will open the Google map. But if I'm not going to Kolhapur, I'm not going to use the Google map. It's as simple as that.
Right. This is a question from Jaya Prasad. Somebody who's having a normal heart health, does a varicose vein have an adverse effect on the heart? Um, After a certain age, is everyone prone to get this varicose veins?
No, not everybody. Varicose vein doesn't have any direct effect on a heart. If your heart health is good, one need not worry about varicose veins. Is not related to heart health. But varicose vein itself, if they are extensive and severe, can cause the problems which I mentioned earlier about developing thrombosis, clots, bleeding, wounds which don't heal, and that is the reason they should be addressed in time.
Right. This is a question from Shobha Srivastava. What is lateral fibrillation? Fibrillation? Is it dangerous?
You're talking about
Atrial,
atrial fibrillation.
atrial fibrillation.
Yeah, so atrial fibrillation is basically fibrillation or some sort of arrhythmia or irregularity which happens in the heart because of heart conduction problems. And generally, these patients are put on blood thinners because these patients tend to develop clots because of irregular rhythms of the heart. And these clots can be thrown anywhere. They can go to brain, cause stroke. They can come down into legs and cause sudden cut off of leg circulation. They can go to kidneys or any other organs, and which is why atrial fibrillation should be controlled and treated with necessary heart medications and sometimes with the blood thinners also.
Right. Doctor, we have a question on calf pain. Would your response be the same as cramps? For that, what is the reason for calf pain and what is the best treatment?
So calf pain, which comes only on walking and goes away on stopping, it is definitely because of narrowed arteries of the leg. Calf pains, generally cramps would happen at night, and cramps generally would happen sometimes in calf muscles, sometimes in the toes, sometimes into the thighs. So that's the different. And calf pain, which comes only on walking, or if you're standing for a long time. So these are the problems what I mentioned as a leg attack. So it could be because of blockages in the arteries or because of varicose veins.
Right. Doctor, a lot of people have asked us questions about what is the way to prevent varicose veins. Is there something that you could suggest to people who have not got varicose veins? And you said that it doesn't happen to everyone at a senior age. Is there anything that you should just do to prevent it on a regular basis that they could do?
So let's start with what is the cause of the varicose veins. So obviously, as I mentioned earlier, they run in families. You cannot change your genes. So if somebody in the family has varicose veins, one should be getting it screened every now and then, every 2 years, 5 years, to make sure they don't have varicose vein. Number two, if you have a varicose vein in the family or otherwise also, you should not basically stand for too long a time at one particular place. You can walk around, but should not stand for a long time. Same goes true for sitting for a long time. Number three, especially in an elderly population, if you don't have developed any varicose veins till the time you reach 60s and 70s, the less chances that you will develop varicosities later on. It only happens on during your productive years, especially from 20s to 50s, and if you have a long-standing hours.
Right. Doctor, is there any recommendation about physiotherapy or exercises that one must do apart from what you just said, recommended?
Physiotherapy generally, by and large, will not help here. The only way, basically, you can and one can do is to strengthening of your calf muscles, especially for varicose vein. So the simple exercise is that you do up and down on your toes. That would basically strengthen your calf muscles. And walking itself is a good exercise to keep the calf muscles going and pumping the blood up from the veins. And that would basically prevent any varicose vein formation.
Right. And yoga, is there something that you, apart from what you said, is there something that you would recommend that people do?
Yoga should be okay, but if somebody has a varicose vein, then they should avoid Vajrasana because in Vajrasana, you put your legs backward and that may damage your varicose veins.
All right. So Vajrasana is something that one must avoid. Thank you very much, Doctor, for a very, we've been able to respond to at least 22 questions this evening. And
I hope it was helpful to all the people
it was very
attending
helpful.
because
It was
some
very
people.
helpful. We've this is a question. This is an issue which concerns a lot of people, and we've also received requests for this, as well as the team at Ruby Hall. Thank you to them to facilitate this. Thank you very much, Dr. Dhanesh Kamerkar, for being here and for this session on leg attack and dealing with uh, uh, you know the peripheral artery disease. And to all of you here, thank you very much for joining. We will be back next Saturday at 5 p.m. We have a session on dealing with prostate cancer. September is the month for prostate cancer, and as you know that prostate cancer is exceedingly common with senior men. So that's a topic that we are dealing next Saturday at 5 p.m. Do join us then. And thank you to Dr. Dhanesh Karmekar for being here. And to all of you, do remember we have a host of things happening on Evergreen Club, on our Seniors Today magazine. The magazine was out on the 15th, and we are working on the next issue. But the website is updated every day, Monday through Saturday, so you can subscribe to the newsletter. And of course, enjoy all our programs, which are there in the morning, afternoon, and evening. They're all free of cost, just as this session is. So take advantage of what we have, and we will be back with you next Saturday. Thank you.
Thank you. Thank you.